For the venous sinus drainage technique, we're going to start off with our hands palpating the transverse sinus. So you'd go to about the inion region and then have your fingers placed laterally. You're going to place tension into the periosteum, into the dura, and then just think a little bit of lateral traction until you feel a softening. After you feel a softening at the transverse sinus, you're going to go to the confluence of sinuses, which is essentially located at inion. Again, using maybe 1 to 2 fingers on each hand, putting a little bit of pressure, a little bit of lateral traction on that dural layer until you feel a softening. After that, you're going to go to the occipital sinus, which is working from the confluence of sinuses or inion and inferiorly. And again, a little bit of lateral traction until you feel a softening or a change in the tension of the dura. Next, you'll be going to the sagittal sinus, superior sagittal sinus along the sagittal suture. Notice how your fingers are crossed, and that's going to create a lateral traction along the suture line that's going to affect the sinus underneath. So as you check each one of those segments, you're going to hold that lateral tension until you feel a softening, and then you're going to work your fingers one on top of the other, repetitively waiting for those releases, spending more time obviously in areas that are more restricted, and you're going to work your way all the way along the sagittal suture. And then you end by treating the frontal bone in the same manner. It's a good idea to treat the OA region and the thoracic outlet along with that to ensure proper drainage.